Welcome to Next Generation Healthcare, proudly presented by Optimal Telehealth. Are soaring health insurance costs for your family or business causing you stress? Tired of the long waits and high fees for a simple doctor's consultation? Then you found your podcast. Next Generation Healthcare is here to empower you to take back control over your healthcare decisions, freeing you from the constraints set by insurance companies. In our episodes, you'll uncover the secrets to circumventing traditional insurance to access direct services from your preferred providers at savings of 40 to 50%. This podcast is a creation of Larry Stout, the visionary founder and CEO of Optimal Telehealth. Now, let's hear from Larry.
Hey, welcome to another episode of Next Gen Healthcare podcast. Appreciate you dialing in to take a look at what we're doing. I'm excited about today's episode. We've got a special guest I want to introduce to you. And to wrap up that introduction, I want to tell you how I met Crystal. Early this year, I read a book by Marshall Allen. He calls it, the title of the book is Never Pay the First Bill. And Marshall has done a great job of providing information about how consumers should deal with the healthcare industry. And I read the book, found it very informative, and Crystal, my guest today, was a contributor to that book. Unfortunately, this past summer, we lost Marshall unexpectedly. He went to be with the Lord, and but his wife, Sonia, survives him and carries the company on. The Allen Institute is an ongoing endeavor, and I encourage you to read the book. This is what it looks like. I'm sure you'll find it on Amazon or most any places you buy your books. And there's an audio version of it as well. But Sonia's wife is going to carry that on, and she's got some great, the institution they have has got some great information about how to deal with the healthcare industry. I always say that Marshall was an antagonist for the healthcare industry, and Optimal Telehealth is somewhat of an antagonist for the health insurance industry. But this is where I learned about Crystal Polson. And I ran her down this fall. I wanted to get in touch with her, and she had moved off to Australia. So she's in the land of kangaroos and the outback and the Great Barrier Reef, and I think some fairly good beer too, if you're so inclined. Anyway, Crystal, this is Crystal Polson. She's a healthcare advocate, and we're going to talk today about healthcare advocacy and how it might play a role in your life. So welcome. I'm glad you're with us today, Crystal.
Yeah, thank you, Larry. So am I. This is a topic that is very near and dear to my heart.
Well, good. You know, my experience has been just not enough people understand what it is or know that it even exists. And that's been a frustration for me, but we'll do our little bit here as much as we can to spread the word and educate some folks. Let's start by having you tell us a little bit about your background, your professional background, and how you got into advocacy. I know that you have a degree in nursing, I think, if I'm correct there. So tell us about yourself.
Yeah, so I've been a nurse for a long time now, Larry, going over 20 years, and I have been into everything. So critical care nursing, cardiology, consulting, on-site health. Now I'm doing workplace health. So I've dabbled in a lot of things. The way I got into health advocacy was very early in my nursing career. I would say it was only about a year in, and I really started to notice, first of all, when you get your nursing degree, everybody starts calling you, friends, family, asking for advice, and thinking, well, look, lots of people just don't know what they don't know. And I also saw this in my work in the hospitals, that when you're going through a new diagnosis or a healthcare crisis, you feel overwhelmed and you have no idea what to ask. So I said, this is a problem. So I wanted to solve it. And I started a business called Blue Compass. And that was, at the time, this was over 15 years ago. At the time, I was one of the only people doing that. There was a handful of other, self-proclaimed patient advocates in the U.S. And I set up that business to help people. And it kind of just grew from there. And I went on to another company and helped through advocacy, and I started a blog called Prudent Patient to help people navigate the healthcare system. It's becoming even more complex, and it's very easy to get lost in translation when it comes to healthcare. There's two systems of healthcare. There's the system side where your bills and knowing where to go and what doctors to go to. And then there's the health side, your own health or a loved one's health. So there's really two things that you have to navigate as a patient.
Could you help me define help our listeners or viewers define for their benefit, what is a healthcare advocate? What is that job?
A healthcare advocate is someone who is going to be by your side, help you understand things that you may not understand. There's medical jargon, there's complex diagnoses that as a general layperson, you may not know what you're dealing with. When you're working with an advocate, this is usually a person who has expertise in whatever it is you're dealing with. They might have a healthcare background or a medical billing background. So it's someone, I can compare it to having an attorney help you navigate the legal system. This is someone who is going to help you navigate the healthcare system and understand what questions to ask and help you understand to know what you don't know.
Sure. Okay. And those services, I assume, can be delivered virtually over a telephone call or a video conference, or obviously you could meet in person with an advocate.
Yeah, that's right, Larry. It can be as simple as you may have one issue that you need to ask a patient advocate about, and that might be a quick phone call to ask a few questions and get you on the right page. Or it could be that you want someone to be physically present with you at your doctor's appointment while you're asking questions, someone physically by your side. So it really runs the gamut from a phone call down to very personalized services.
I'm glad you brought that up about active participation because, for instance, my friend who had the billing issue, he did it virtually, but he signed a few release papers giving the advocate authorization to deal with the hospital, and she just contacted the hospital directly and went through every item on the bill and straightened everything out. So it's not like the advocate's just going to provide information and let the consumer, let the patient do the work. The advocates step in and have the ability to step in and totally take over.
Absolutely. And it really depends on what you need as a patient, Larry. Depends on what level of support you need. Some people are much more literate in healthcare than others, so that it's highly dependent on your needs. And the good thing is now we have FaceTime and we have Zoom, and you could even bring your advocate with you on your phone and flip them on at your doctor's appointment. So with technology, it's improving our access to advocates, which is wonderful.
Well, it's not a place for timidity. No, advocates have to take charge of situations to accomplish their objectives for their client.
Yes, absolutely.
Well, you're definitely an early adapter, and that leads right into my next question. The entire concept of patient advocacy hasn't been around that long. What do you think happened in the healthcare industry that created the need for patient advocates?
Yeah, I think a couple of things have happened, Larry. First of all, again, the healthcare system is becoming more complex, especially around your medical bills and navigating what insurance pays for, what they don't pay for. It's just, even for me still, it's mind-boggling. The U.S. healthcare system is fundamentally broken, and it can be absolutely impossible to navigate. And the other side of that is we are seeing more and more treatments and more people getting diagnosed and more options for treatment. And it can be completely overwhelming to know which way to go. What's right for one person may not be right for another person. The good news is I can see that the tides are turning on patient advocacy and getting the word out there. There's a accrediting body now that certifies patient advocates that was not around when I first started. So it is becoming a more accepted and popular avenue for patients to take.
And I might point out, again, that touches on another question you talked about, touched on the association. It's called NAHHC, National Association of Healthcare Advocates. And I would suggest that if you're interested, any of the viewers that are interested should go out there and check out their website. I'm sure it's full of helpful information.
Yeah, definitely. That's a good platform to start with. If you don't know how to find a patient advocate, that's a great one. Go there. It's a repository of advocates. And then a separate body called the Patient Advocate Certification Board is it's a different website, but they certify patient advocates. So you sit for an exam, and that's another good place to go for information.
That's fantastic. Thank you. Share some, I know you've had a lot of experiences, but if some stand out in your mind as particularly poignant, could you share some of those with us?
Yeah, look, Larry, one of the poignant ones is exactly the one that you read about in Marshall's book. And I worked with Marshall for a while on this. And this was, again, back when patient advocates weren't really that known. And long story short, my son went to the emergency room and was never seen by a doctor, and come home, and I started getting medical bills. They were pouring in. And the first thing that I did was go to the hospital and grab the medical record, because the medical record is a story. It will tell you a lot. But again, you have to know what you're looking for. And as I start reading this medical record, I see that a doctor has filled out an entire exam on my son. And again, he was never seen by a doctor. So this was shocking to me. Maybe it shouldn't have been, but it was. So that spiraled into me getting a bill from my insurance company for a exam that was never done. And it took me over a year to get that rectified. And that's what Marshall and I worked on together. If I hadn't have gone back, and if I'd have just looked at that bill, paid it the first time, sent the money in, a doctor was getting paid for an exam that she never did. It was fraud, and it's called upcoding. So that's one story. And then very recently, Larry, I had a friend here in Australia. Her daughter had to go to the emergency room. She was diagnosed with pneumonia, and they sent her home. And they sent her home in an unstable condition. And they told her mother to go by the pharmacy and buy a oxygen monitor and monitor her oxygen. That should not happen. So the friend called me. This is around 11 o'clock at night. She calls me and says, something doesn't feel right. She's breathing heavy. Her nostrils are flaring. Her oxygen level is low. But this is the way they sent her home. I said, no way. Go straight back to the emergency room. Go to a different emergency room. And they admitted her child, and she was in the hospital for over a week. So you really have to be careful, and you have to advocate for yourself. And sometimes that can be very scary, Larry. You go to the doctor, you go to the hospital, and a doctor tells you everything is fine, and you believe them. And if you don't have anyone to call, or you don't have anyone that might know what questions you should be asking, you can be in real trouble. Sometimes it's a matter of life or death.
Oh, yeah. Yeah. You know, you mentioned upcoding. I just want to point out that in a future episode, we're going to drill a little deeper down into upcoding. It's a practice used in the medical industry too often, and you might wonder why the insurance companies don't crack down on it, but there's a reason why they don't. It can be to their benefit. So we'll talk about that more in another episode.
Yes, it is to their benefit.
Yeah. In my personal experience, I've found that the average consumer is largely unaware of the availability of patient advocacy. So for those few who are, they really don't know what they can accomplish with a patient advocate. They don't know what you do. You've obviously touched on some of that already, but what needs to be done to educate consumers about and raise awareness about advocacy?
Look, now that almost all of us are on social media, that's a great place to raise awareness. In some form or another, almost all of us are engaging on a platform. So that's a good place to start. And word of mouth, Larry, if you've talked to someone else who's used a patient advocate, and knowing what we do and knowing how we can help. And the easiest way to tell you what we do is think of us as tying the system together for you. So it's very fragmented. You might have a doctor for your heart, a doctor for another condition that you have. A patient advocate can help tie all of that together and make sure that everybody is on the same page. And that can be very difficult to do without somebody in the middle who understands what questions to ask and understands the system.
Good. Well, thank you for that. Consumers, it's been my experience with telehealth services, telemedicine, behavioral health counseling, etc. There's a lot of trepidation if people aren't used to it, and most aren't. There's a lot of trepidation about picking up the phone the first time and calling a doctor to diagnose or treat a condition. How would you advise people to, at what point do they become aware that they wake up in the morning and say, gosh, I need to go out and find a healthcare advocate? I mean, at what point does that light bulb come on, or what drives them to that?
Yeah, well, first you have to know that healthcare advocates exist and that is an option for you. So it is getting the word out. But my advice is, if you ever feel overwhelmed by what you've been told, or you have no idea where to begin, you've been given a new diagnosis, it feels overwhelming, it feels scary, where do I start? A great place to start would be a patient advocate, a healthcare advocate. If you get medical bills that are pouring in and they make no sense to you, and most likely they will make no sense to you, find a medical advocate that deals with billing. So it really is at that moment when you are asking that question or you're unsure, you don't know where to turn, that's a health advocate is a great place to start.
You mentioned straightening out billing problems. That brought to mind a good friend of mine. I walked into his house one day and he was sitting at the dining room table going over some medical bills. He had just been through a session, a few days in the hospital, and he was shaking his head. And I said, "What's going on?" And he said, "Well, look like right here. Here's the same charge for $900 and whatever dollars it was, $923, and they charged me twice for the same thing from two different doctors." And I said, "Well, call your healthcare advocate," because he used our services, our virtual services, and he said, "Great idea. I need to do that." Sure enough, what do? They call the hospital. They just go through it and get all the duplicates and all the problems straightened out. It's so simple.
Yeah, that's right. It's if you don't know what you're looking at, it can be, it's overwhelming.
I mean, he caught that one thing himself, but and he could have straightened it out, I'm sure, with a phone call, but how much else was on that bill? He was in the hospital for several days. It could have been any number of problems with that bill. So
and thus the title of Marshall's book, Never Pay the First Bill. And that is never pay the first bill, Larry. It's almost always 90% of the time there's going to be an error on that bill, and you have to know what you're looking for.
Well, because I promote and sell medical cost-sharing services, I know my cost-sharing community always requires a detailed bill, and the hospital's medical providers can very easily give you a bill that lists every single item on it, and that's what Marshall prescribes in his book. He says, always get that detailed bill and go over it.
That's right. They're not going to give that to you. You have to ask for it.
They want the summary version. They'll give you the summary version.
The very obscure summary version, yes.
What would you say to someone who's concerned about the cost of a healthcare advocate? I mean, obviously medical services are expensive, so everybody's cost conscious. We don't want people to shy away from it because of the potential costs. So how would you address that?
Yeah, you have to ask the question, what is your health worth to you? It's you can compare it to navigating the legal system. Lawyers have been around since the dawn of time, and no one really hesitates to, even if it's a stretch financially, no one hesitates to pay a lawyer because that's going to advocate for you in a complicated system like the legal system. I would argue that the healthcare system is even more complex and convoluted than a legal system. So if you think of it that way, you wouldn't hesitate to pay a lawyer. Don't hesitate to pay a healthcare advocate to be on your side.
I think they're well worth the money. They'll always say, in my opinion, they'll save you more than they'll cost you. we talked earlier about the best way to find a healthcare advocate. You mentioned a website, et cetera. Once you get them, or if you have any other ideas about the best way, let us know. But once you contact your healthcare advocate, how do you screen them? How do you get a comfort level that they're going to do a good job for you and you can work?
Yeah, I think the best thing to do is start out with an initial consultation, and most advocates would do that for free. There would be no cost associated with that. You want to ask questions. Have they worked with people like you in your situation or with your diagnosis before? What are their areas of expertise? You have some advocates that are general advocates, and then you may have some advocates that specialize in certain diagnoses, like neurodegenerative diseases or oncology. So you want to find that match for you, Larry, because you want to be comfortable with that person. This is somebody who's going to be dealing with an intimate part of your life, your medical care or a loved one's medical care. So I'd say start with the NAHHC website, find an advocate, and then have a conversation. You may have to have 2 or 3 conversations with different ones until you find one that you feel comfortable with.
Well, what you've told us today has been very valuable, Crystal. Is there anything else you can add to the conversation that I've missed, I overlooked? Because you're the expert, I'm not.
I push the point. I do this with my friends and my family and anyone that I come across. Don't be afraid to advocate for yourself or advocate for another one. And I know how hard that can be. Even as a nurse myself, there is still that very paternalistic view of our doctors and our healthcare providers that we have to do what they say. It's not like that anymore. It's moving towards shared decision making. So you want to partner with your healthcare providers. They don't always know what's best for you. And that's not to say that they don't know what they're doing. They have no idea. Of course they do, but you're partnering. It's a true partnership now, Larry. And it has to be that way for you to get the best care for yourself and the best care for your family members. Never be afraid to ask better questions and get better care.
Well, that goes to the heart of what we preach every day, and that's take charge of your own health care. The insurance industry, the health insurance industry, unfortunately, over the years has just taken control of everything about our health care, and all we do is hand them that plastic card, and they handle all the rest of it, and we don't really know what's going on. And of course, what we advocate for is taking control of our own health care, and it's what we've talked about today, is you've got to look out for yourself because other people are not going to look out for you.
That's right. It's you will get duped, Larry, if you don't look out for yourself. It is a very broken system.
Crystal, how about this? What do you think the healthcare advocacy? What do you think the impact is going to be on the healthcare industry? Say over the next 5 years, how will it change things?
I think it's going to change things for the better for our patients. And perhaps our insurance companies won't be so happy with it. When you have an advocate by your side and someone that knows the right questions to ask, and they know what to look for on the medical records, and they know what to look for with billing errors, then the healthcare system in general, that includes our healthcare providers, our insurance companies, they are going to be held accountable for what they do. When you're being watched, you're going to have to step up your game. Whereas now, if you feel like, well, you know what, I'm just going to write this exam, the patient's not going to know, or you're an insurance company or you're a hospital and you're putting errors on the medical record or the medical bill, then you think that people don't know what they're doing. The accountability is going to increase as we start to use more advocates.
Right. I mean, we can't overlook the fact that to a great extent, I mean, healthcare is a business, and it's a for-profit business, and these are corporations that have to focus on the profits.
Yep, that's right. And unfortunately, it is profit before people in many cases.
Too often, that's true. I mean, I think we have a great healthcare industry in general. I think we can all agree on that, but there's always room for improvement.
Yeah, that's with any healthcare system, Larry. Been living here in Australia and seeing a completely different system. There's room for improvement.
Nobody wants to be taken advantage of. So
no one does.
Crystal, your input today has been invaluable. I thank you for coming on. I hope we get together again in the future and maintain a good long-term relationship.
Yeah, so do I, Larry. Thanks so much for having me on.
We hope you found this episode informative. Until next time, remember, Next Generation Healthcare fosters a brighter and more empowering future for all. Thanks so much.
Thank you for tuning in to Next Generation Healthcare, brought to you by Optimal Telehealth. Your engagement means the world to us. If you find our content informative, follow our podcasts on Apple, Spotify, or YouTube. We welcome your participation and will review listener input in future episodes. To leave your questions or comments, access additional episodes, or browse our blog post library, please visit the resources page at optimaltelehealth.com. You may also connect with us on LinkedIn, Facebook, or Instagram for the latest insights and updates. We look forward to welcoming you back soon. Your journey towards empowered healthcare continues with us.